Access to quality healthcare without hardship is a stepping stone to realizing the human rights to health and to social security. It is key to achieving the Sustainable Development Goals, striving towards universal health coverage and universal social protection. The first regional report on social health protection in Asia and the Pacific, compiled by the International Labour Organization, analyzes country experiences and lessons on the extension of coverage. The evidence shows that in the Asia-Pacific region, 3 out of every 4 people are legally covered for healthcare. Insufficient legal coverage, lack of awareness and barriers to access still leave 1.6 billion people effectively unprotected by a healthcare scheme. This situation is made worse by further gaps in sickness and maternity benefits coverage, leaving many of those who are unable to work because they are sick or giving birth without any income. Women, migrants, informal workers and those with irregular employment and their families remain disproportionately unprotected. Adequacy of benefits also remains a challenge in the region. Notably, a strong focus on curative care fails to meet the growing needs of an aging population and one increasingly affected by non-communicable diseases. Inequitable quality and distribution of care also hampers adequacy. This is why securing decent working conditions of health and care workers to improve quality and retention is crucial. The rise of the private health sector, which often remains out of the scope of social health protection, means a growing portion of the population pays out of pocket to access the services they need. This leads to dual systems, one for the rich and one for the poor, further driving inequalities. In 2018, 135 million people in Asia and the Pacific were pushed into poverty by catastrophic health expenditures, representing the biggest share globally. Providing adequate financial protection against these costs must be a priority. The COVID-19 pandemic has revealed the essential role of social health protection in safeguarding people's health, jobs, and income. Yet, underfunding in social health protection in the region remains a major obstacle to expanding coverage and enhancing adequacy. Stronger institutions can help improve the quality of public services to better respond to population needs, especially in times of crisis. Efforts are needed to sustain the progress made in social health protection before and throughout the pandemic. There is no one-size-fits-all model. Strong societal and political commitments, as well as the application of international social security standards, are essential to help build robust, more comprehensive and equitable social health protection systems. Now is the time to make the right to social health protection in Asia and the Pacific a reality for all. Let's work together to attain this shared vision.